Welcome to NorthPoint's community Q&A on COVID-19 vaccine in the Black community. We hope this dialogue will help people make informed decisions about getting the vaccine. We'd also like to thank the City of Minneapolis Health Department for coordinating with us to put this whole event together. My name is Isaiah Jones. I work at NorthPoint Health and Wellness on the human services side, and the vaccine was hugely important to me. It really allowed me to reconnect with my family over this last year. If you have any questions about the vaccine, we ask you to please put those in the chat tonight before 6:30. I'll share some information about NorthPoint Health and Wellness before we kick it off. NorthPoint Health and Wellness is a multi-specialty medical, dental, mental health, and human services agency in North Minneapolis. We've served the community since 1967. We serve people in all financial situations. We help with medical insurance, and we also serve patients on a sliding fee scale. To learn more, please visit northpointhealth.org. At this time, I'd like to introduce Dr. Gilliam, who will be answering all of our questions tonight. Dr. Gilliam has been a member of the NorthPoint family since 2009 and serves as Associate Medical Director. Dr. Gilliam was named Minneapolis St. Paul Magazine's Top Doctor Rising Star in 2017 and was also recently featured in the Star Tribune's Our Best Shot series. Dr. Gilliam?
Good evening. How you doing, Isaiah?
Doing good. Thank you for being here.
Thank you. Yeah, thanks for moderating this conversation. It's a real important discussion that needs to be had over and over again. So I'm glad you're able to squeeze this in. And thank you for the introduction as well. As you mentioned, I do serve as the Associate Medical Director at NorthPoint, and I've been at NorthPoint now for 11, almost 12 years. Prior to that, I did complete a residency in family medicine at Emory University. And while I've been working at NorthPoint, I've completed a fellowship in obesity medicine as well. Prior to that, I went to Tennessee State University for undergraduate education and to the University of Cincinnati for medical school. But I'm originally from Maryland, the DC area. But I've been glad to be living in the state of, 10,000 Lakes these last 10 plus years. And my specific role with respect to vaccination is that I've helped in the coordination and implementation of our vaccination strategy at NorthPoint. From the very beginning of the availability of the vaccine back in December of 2020, we started first administering vaccinations to our staff, and then when available, started vaccinating the community. So I've helped in coordinating that along with a very large team of people from NorthPoint to make sure everything goes very seamlessly, efficiently, and professionally, that we get all these things done and as many people vaccinated as wish to be vaccinated in our community.
All right, so let's just jump right in. We're going to start by talking about the data a little bit. Dr. Gilliam, why is the COVID vaccine important for the Black community in particular? Well,
the data is interesting to those of us who like to hear about numbers and data. But I kind of like to take a long view of what COVID has been in the community. So if we think back to 18 months ago, 20 months ago, when we hadn't heard of a COVID-19 ever before. Back when it first began, particularly in the Black community, we didn't think it impacted us as much. Like, that was the rumor at the time. Like, people in the Black community did not seem to be getting infected or affected by the virus itself. But then as it progressed, we started to see that not only was that not the truth, but we in the Black community were being impacted and affected by the virus at much higher rates than many of the other communities. And we also, not in that impaction, we're being hospitalized more often, we're dying more often. And we found that was due to a lot of different reasons, not just because the virus liked us more than anybody else, because anyone can get infected with the COVID-19 virus It's just that some of the things that were already present in our communities that may not have been of our doing kind of led to us being impacted more heavily than some other communities. But, it's been, when looking kind of at our perceptions of the vaccine in the community, I think there are kind of two camps of people that remain now. And so you have the people that are in or were in the wait and see camp. And those people are those, I just want to wait a little while longer, kind of see how this vaccine kind of works in people that I know and love, and let y'all get it first. And I think about it, I'll get it later. And I think the other group of people is the never ever camp. I don't care what you tell me, I'm not getting this vaccine. And, there are people like that no matter what the vaccine is, flu or any of that stuff. But it's been my perception, looking at how our numbers have been steadily increasing these last several weeks and months, that there's a larger portion of those in the Black community, specifically kind of where we sit, that are in that wait and see camp, that are being slowly convinced into or persuaded or have gathered enough information to be able to make an informed decision about getting vaccinated, because they now realize that is the best thing for them, their family, and those they love to do and get done. And then, we still will continue to do all the things we do to kind of inform people, no matter what camp you think you are in. If you feel like you're in a wait and see camp or a never ever camp, we kind of give the same information, the same compassionate plea, never shaming people for, what we think may be the right thing to do versus what they're feeling is the right thing for them and their families. But when we look at the community specifically, so if we look at, 55411, where NorthPoint sits, and 12, which is another area code that we serve heavily as well. Those two zip codes have the lowest vaccination rates, or in the top three for the lowest vaccination rates in the state, at 39 and 47% respectively. And then the top is 55454, which is the Minneapolis kind of Cedar Riverside area. And they're just a little bit lower in their percentage of vaccinated. And so the issue with that is that, well, not only does it presents an opportunity for us to give more information to those communities, and also to make sure we're kind of giving that information in ways they'll be able to receive it and hear it. But some of the other issue is that it's the communities that have not been vaccinated that are now being mostly impacted with the virus now, because we see that the vaccine is effective to prevent not only infection, but severe infection that leads to hospitalization and other kind of major issues.
So you talked a little bit about what the data looks like in terms of the Black community's views on the vaccine. Can you talk a little bit about what the evidence is that the vaccine is safe and effective?
Yeah, the initial evidence was presented when the vaccines were first revealed to us, that, we knew they were coming out, and when the FDA approved them, all the studies, all the information that came from those studies was made readily available to the community, to the scientific community, to us. So I've read all of the studies several times to make sure that I had all the information before we began not only administering the vaccination, but before I took my own vaccine. I wanted to be certain that I was comfortable with how the science was done, how those studies were performed. But I think now that we have, if we're looking at the state of Minnesota, have given more than 3 million doses of vaccine, and we know that the rate of breakthrough infection is somewhere, I think there's somewhere just over 3,000 people who've had a breakthrough infection out of 3 million. So if I do some quick math, that puts us at 0.001% of those who have gotten an infection after being vaccinated. So even though it does happen, the percentage of those who it happens to is exquisitely low. So that proves to me that is effective. And the fact that at NorthPoint, we've given almost 16,700, almost 17,000 vaccines and have not had any serious side effects outside of those we would expect. No big safety concerns. And the same can be said for those being vaccinated in the state more broadly. That proves to me that it is safe because the proof is in the pudding. Because you can talk all day about how safe it is, but it's not until you actually see it in the community and you can prove it outside of the studies, and that's been done. So I think we can say fairly comfortably that it is both safe and effective.
Okay, let's talk about actually getting the vaccine then, and your experience. What did it feel like after you got the vaccine? Like right after you got it, a day after, 2 days after, 3 days after? How'd you feel?
I mean, honestly, everyone has their own experience after the vaccination. The most common side effect of people, and we're talking 80+%, get a sore arm. And that happened to me. So that the day of, or shortly thereafter, and it was sore that night and maybe the next day. But I actually didn't have very many side effects or symptoms following. I do remember going sledding because it was in the winter when I got mine. I went sledding the next day. And so I think my back hurt more from the sledding than and rolling down the icy hill than actually getting the vaccine. But I felt fine. But I do know that aside from the sore arm, people do feel some fatigue often, so some tiredness. And then oftentimes people can get some muscle achiness, some joint stiffness, sometimes headache, sometimes a fever. And those things do tend to go away within a day or 3 at the most.
How about does the vaccine interact with any other medications that somebody might already be on, or any other conditions that somebody might already have?
Well, that's a fairly kind of nuanced question or answer, I would say. Generally, no, it does not interact with any medication that you would be on. The caution would be if you are on a medicine or take a medicine for a condition and the medicine suppresses the immune system in some way, then you would want to discuss like timing of the vaccination and potential decreased effectiveness of the vaccine if you're on a medication that would decrease your immune system's ability to form the protection that you need. So it has to kind of jump into action once you are given the vaccination. So if your immune system is unable to jump as high as someone else's because of the medication you're on, you may want to discuss that with whoever your provider may be to see if there may be another plan for you in terms of the normal vaccination strategy. And that would, generally that would be kind of what we would think of in terms of kind of medication interactions, but there is, nothing of those typical medications that people are generally on that the vaccine does not interact with any of those.
How about, is there anything I can do to prepare to take the vaccine? Like, take some Tylenol beforehand, or maybe some Benadryl or an EpiPen?
I think, the only thing people really need to do to prepare is take a breath and, put on your favorite short sleeve shirt so that we have easy access to your upper arm. But there's no need to take any Tylenol or ibuprofen or naproxen or bring an EpiPen with you. unless you're a person that just gets tons of allergic reactions. But we always have EpiPens and Benadryl and all of those things to help if there is an immediate allergic reaction to something. But there is no requirement for you to bring anything, to take anything ahead of time. Now, if after getting vaccinated, your arm gets sore, get a headache, your muscles get stiff or joints get achy, then Tylenol is what we recommend to take after you're vaccinated. But if you don't feel like you need that, then you don't have to take it. But Tylenol has been found to be the most effective medication, or acetaminophen is the other name for it, to help in reducing symptoms that you may get after being vaccinated.
Yeah, that's really good to know. I don't think I knew that about Tylenol when I had my vaccine, to be honest. Okay, so this next question may be a little controversial, but after you get the vaccine, do you need to keep wearing a mask, social distancing?
Yes. Not too controversial for me, but you're not considered to be fully immune or fully immune until 2 weeks after you've been vaccinated. So you'd still want to kind of maintain the masking practices, the distancing practices that you've been doing up until that point. And then once you get to the 2-week mark, after that second dose of your vaccination, if you do Pfizer or Moderna, or 2 weeks after, if you've done the Johnson & Johnson, 4 weeks after with the Johnson & Johnson, then you can then follow the rules of where you are in the community. Because if you've been paying attention in the news, different kind of mask mandates are changing, and recommendations are changing based on kind of what community you live in, where you're going. At NorthPoint, we do require masking if you visit us. So depending on where you are and the rules of that place, you would need to follow those rules. But the CDC has changed its recommendation here recently with regard to masking. I'm in full support of that increased protection with the mask.
How long will the effects of the vaccine last? And will we have to get a booster shot at some point, or another vaccine?
Excellent questions that are answers are being actively sought, but we have no idea. Just as this vaccine didn't exist before 2020, so it has not been in use for longer than a year at the moment. So we don't know exactly how long the efficacy of it will last. There are some thoughts that it will last for years. There's a possibility that it doesn't last that long, but we just don't know. And even though, the companies are developing booster shots, there's no evidence that we have at this moment today that a booster shot is necessary. The current thinking is that if you received any of the 3 approved vaccines that we have in this country, so the Pfizer, Moderna, or Johnson & Johnson, that you do not require a booster shot at this time.
Great. A quick reminder, everyone, post your questions in the chat before 6:30, because we'll definitely have time to answer some of your questions later on. But now we have some questions from the community. I think we have a few videos for a few more questions.
Yes, my name is Anthony Jones. My first question is the Johnson & Johnson vaccine safe and effective? I heard that there were some problems with it.
Thank you for that question, Mr. Jones. And yes, it is both safe and effective. From the initial data, we did see that it was, perhaps a bit less effective than the Pfizer and Moderna, but not by much. It had an efficacy preventing severe disease of 85%. And Pfizer and Moderna had 95 and 94.5% respectively. So they're about 10% better at preventing severe disease and hospitalization than the Johnson & Johnson. And so they, in the grander scheme of things, all three of them are excellent in terms of efficacy and safety, because they all had similar safety data. And there have been some kind of issues that have kind of come up since they kind of debuted back in kind of earlier this year in late 2020. But, you know, those things that have come have been found to be kind of exquisitely rare to happen. And we're talking kind of 1 in a million in terms of how often some of those things are happening to folk. You know, so when we look at where we were in terms of pandemic kind of in earlier this year, I think the risk benefit ratio, it definitely benefits more to not be as vulnerable to COVID-19 and get a vaccine that you're comfortable getting.
Great. Okay, next question.
Well, hello, thank you so much for this opportunity. My name is Z. I've been living here in Minneapolis for about 3 years. I appreciate the opportunity for you guys doing this for us. You know, my sister's is pregnant, and we've been wondering about this. Is this vaccine safe for pregnant women? Can pregnant women be able to take this vaccine? Thank you.
Short answer is yes, they can. A little longer is not only were there some women in the studies who were pregnant and did not have issue with it, but since then we have been administering vaccinations to pregnant women. But always, whenever anyone asks, I kind of dodge the question so that pregnant person is able to have a discussion with their provider. So whoever it is that is taking care of them during their pregnancy, I want them to have a fully engaged conversation with them, so they really understand all the kind of the risks and benefits with being vaccinated, also with the potential of getting COVID-19, because being infected with COVID-19 while pregnant comes along with more complications than one would assume after being infected.
Okay, we have another question here.
Hello, my name is Peggy. Does a vaccine still protect us against the new variants like the Delta?
Thank you for that question, Peggy. And I forgot to thank Z for his question, which is great. And but it's a really kind of timely question because the Delta variant is on everyone's mind. It is the reason why mask recommendations are changing. It is the reason why, you know, many people are making different decisions around their vaccination status. But yes, the vaccines are effective against the Delta variant. The trick with it though is that you have to have, if we're talking about the Pfizer or Moderna, which are mRNA vaccines, that's where the studies are that have come out. You have to have had both doses for it to be really effective. After just one dose is really only about 30 to 40% effective, but it's after that second dose that it then jumps to in the 80% range of efficacy against the Delta variant. And, you know, that's one of the recent studies out of, I think it was Britain, that kind of revealed some of that data. And you know, I think they're still studying how effective the Johnson & Johnson vaccine is against the Delta variant. I know that I've seen some reports that it is effective, but I don't know the exact numbers yet on how effective it is. But those are kind of still being studied and evaluated. Those studies that are out have been for Pfizer, but since Pfizer and Moderna are the same type of vaccine, we assume that you would get the same amount of protection with either of them.
All right, great. A couple more questions here, then we'll get into some of the myths of COVID-19.
What are some of the considerations that I should be making when trying to get the vaccine? Like, which one should I pick? How do I know which one to go for, and which one is the most effective for that matter? Do I go for Johnson & Johnson, or do I go for Moderna? What are some of the things to consider? Thank you.
Z with the great questions. So, I think what you should consider is your personal situation. You should think about your own health. Think about the health and well-being of those who you love and those who you care about. And then consider how being infected with the virus might impact you. If you're thinking about your personal situation, how being infected with the virus might affect those you love and care for and live with, how it might impact them. And then I would ask people to consider that being infected with COVID-19 doesn't end after a 14-day quarantine necessarily. Not everyone experiences COVID and just gets to stay home for 2 weeks without any symptoms. Many people really suffer with it. We've lived, through a year and a half so far where a lot of people have gotten really sick, have been hospitalized, have been in ICU on breathing machines, have died. People lost family members. Those who survived, still have what we call like long COVID. So still symptoms that last beyond the COVID diagnosis, so thinking about or considering that your situation, that situation of those you love and care for, and then what it would mean for your life to change dramatically if you were to be infected with the virus, and really just making an informed decision. So if you're, listening to people that you trust, looking for information that you find reliable, and then having these types of conversations to get yourself to a place of comfort so you can make the best decision for yourself, your family, and then ultimately the larger community when hopefully you decide to get vaccinated. I think no matter which of the vaccines you choose, you can't really make a wrong decision there. Because if you don't choose any of them, you're leaving yourself fully unprotected from the COVID-19 virus.
Thank you. We do have some additional questions, I believe, in the chat here. So I'm going to ask a few of those. Question coming in from Sherry. Someone that's vaccinated, if they get COVID, are the symptoms the same? So I'm vaccinated. If I get COVID, are the symptoms the same?
Generally, they are, but they typically are less severe. At least that's what the trend has been. Because I have seen a few people who have been vaccinated and then tested positive for COVID. Many of them were asymptomatic, meaning didn't have any symptoms at all. A few had a few symptoms, but generally it is less severe and of a shorter duration, so it doesn't last quite as long as in other situations.
Great. Another question here. This one says, I missed my second Moderna vaccine. What should I do?
Get your second Moderna vaccine. There is, we recommend that you get it within 4 weeks, but if it's now been 3 months, get yourself scheduled, get your second vaccine, we don't find that it is any less effective. We decided as a country to do everyone at the recommended intervals. But if you look in Europe, many were separating the first and second doses by 4 months. So go get your second dose. It will help to ensure that you are protected. Yeah.
We do have 2 more questions.
Is it safe for children and teenagers to get vaccinated? The reason I ask is I observed being in a public space, grocery store, children that were probably at the age of 5 to 10 running around with no mask. The adult didn't have on a mask. And that concerned me. Shouldn't they be wearing masks?
So there were 2 questions there, Peggy, and I appreciate them both. I'll take the second one first. Yes, they should be. The current mask guidance tells us that those who are vaccinated don't need to wear masks in public spaces unless otherwise instructed. But it says those who are vaccinated. So if you're unvaccinated, then you do. And so we know just by knowing that the vaccines can only be used in those 12 and above, that anyone less than 12 is unvaccinated and therefore needs to wear a mask. So yes, they should be wearing masks. And then to your first question, is it safe and effective? The same types of kind of rigorous study, if even not more rigorous than in the adults, was done to kind of prove safety and efficacy in teenagers and children down to age 12. And even though it's currently not approved for those less than 12, the studies are currently ongoing. But we did find that it had the same types of side effects, so fatigue or tiredness and kind of fevers and headaches and joint stiffness, arm soreness that occurred in an adult. And so not majorly severe and would resolve just as quickly as it does in adults. What I did want to kind of bring up, I guess, in addition to that, even though you didn't ask, Peggy, is that we do need as many of our children to be vaccinated as possible, because our children make up a large portion of our total population. And so without them being vaccinated or kind of helped in their immunity, the virus, it has a place to go. So if I'm immune to the virus and Isaiah's immune to the virus, and then we have Peggy and then Mr. Jones are not, and then Zadok has it or Z has it, both Peggy, Mr. Jones can get it, and then they can go spread it to their family. But myself and Isaiah may not be able to pick it up as easily. And so, but if 4 out of 5, if 4 of us are vaccinated and only 1 of us has an infection, then the virus has really no place to go. Then it just does what it does in that one person, and it stays there. And so it then doesn't spread to anyone else, and it kind of ends its life cycle. So the more of us who kind of have this protection, the less opportunity the virus then has to then kind of keep moving through the community. And without as many of our children being vaccinated as possible, it'll be more difficult for that to happen, because we love our kids. So we continue to have them and they stay with us. So we do need them to kind of have the similar protection that we as adults would have.
I believe we have one more question here from the community before we jump into some of those myths.
So my name is Anthony Jones, and one of my concerns is if they're such a concern about these different versions of COVID-19, why aren't we doing mass vaccines, vaccinations from similar to what we're doing with polio and measles? Why haven't we taken it to that level? What are we waiting for?
It's a good question. I think, and thank you for it. I think I would say though we have done the mass vaccination part of that question that I'm hearing, because not only did kind of states jump into action, and so the state governments, the county governments, but the federal government jumped in action as well. And in the federal government's part, in actually removing a lot of the barriers, a lot of the red tape that's often in the way of getting things done was removed for the development of the vaccine. And then once it was developed, kind of streamline the process for it to be evaluated, and then eventually approved for use. And then kind of making sure it was distributed to all the places without much of a barrier for us to receive them. And then a lot of us, NorthPoint included, have really kind of shut down certain operations and really kind of focused a lot of our efforts. In the beginning, we were testing, and now we're vaccinating. So, big push, a lot of staff, a lot of investment of time, and to really reach out to as many in the community as we could with the vaccination. I think though what I'm hearing a bit in that question is the question around mandates or requirements. And I think if we look kind of in the news recently, you're seeing a lot more kind of private organizations or private businesses, a lot of state governments. The federal government announced yesterday or today that civilian employees will be required to be vaccinated, or get some regular amount of testing. So I think people are moving in the direction of, encouraging people or making it more mandatory to be vaccinated, but leaving an option if you still have a conscientious objection to being vaccinated, that you would then be tested with some regularity to make sure that everyone is safe. So I do think, that we are moving in that direction. I also think we have kind of done a lot up to this point in the efforts to get people vaccinated. And, just for some perspective, most of us who went to public school had required immunizations. And if you're if you're a veteran or you join the military, there are required immunizations. Those of us who work at NorthPoint have required immunizations if you see work directly with patients. So kind of measles vaccinations and those is to evidence that you have been vaccinated or are immune to them. So it's not a foreign concept. It's just that we don't often kind of think of it in that perspective, that most of us have already taken required immunizations or vaccinations at this point.
Yeah, that's a great point. Okay, we're going to get into some of the myths of COVID-19, of the vaccine. So I think we have the top 10 myths of COVID-19. First one is that the vaccine isn't safe because it was developed and tested too quickly.
Well, I mean, I guess that would be the top ones. I hear that often. And the truth of it is, though, is that it's been developed over the last 20 plus years or so. The first time we had, it may have been the second time we had an outbreak. It was I think the SARS virus. It was from that time, 20 years ago, that scientists have been studying and working to develop a treatment or a preventative strategy for this type of virus. So they, have been working on this technology for 20 years. And so they had the technology available to create a vaccine when the COVID-19 pandemic started. And then the scientists in China got the genetic structure of the virus fairly quickly and released that information to the rest of the world so that the other scientists in the world could then take the information and then use that to develop the COVID-19 vaccine that we know of as Moderna and Pfizer, so that's the one that people tend to think of was developed, too quickly. And then the Johnson & Johnson used the same technology, but it was just developed a little bit differently than those others. So when we think about it in the grander scheme of things, it was not a quick development at all. It actually took about 20 years to get to a point where we were able to actually execute the technology and the science that came along with kind of the learning about that type of virus itself. And sometimes we often forget that a coronavirus in and of itself is a common virus. And it generally is one that causes a common cold. It's just that the COVID-19 version of the coronavirus is much more aggressive, much more impactful than the common cold. And it is true that it was tested much quicker. I wouldn't say it was tested quicker because it was actually tested on the same or similar timeline as other vaccines. It's just that the steps in between that you would have had to go through some jump through some hoops, that red tape I mentioned being cut earlier by the federal government. They removed all the barriers of, jumping from, one governmental office to another governmental office and waiting months and months for people to review things. They just made sure that everyone was available and eager to look at the data, look at the information so they could really kind of streamline the process. So what would have taken a year or more to approve things would take a week because people were focused and really didn't want to be in the way of progress, but still want to make sure that they were being as diligent about reviewing the data and what they were seeing in the studies to make sure there was no kind of issue with what they were doing. So taking their time to be methodical and making sure that they were kind of doing their jobs the way they needed to be done. And so, yes, it was quick, but it was quick because all the barriers were removed. So we were actually able to if there weren't as many barriers in life for us to do things, everything would be easy to do. But oftentimes there are things put up, not by us, that keep us from being able to kind of have a smooth experience and kind of get things done, not just in our lives, but in the community more broadly.
How about the myth that this vaccine wasn't tested in minority communities, so we don't know if it's safe for the Black community?
That's one I actually had not heard, because it truly is a myth. Because if having read all of the studies, Pfizer, there was a 10% population of those that were studied. 10% of them were Black. Same can be said for Moderna. It was about 10%. Janssen was about 13%. And those are kind of their United States numbers. If you look globally, the only number I could find for Janssen was actually a little higher. It was around 20% of, Black African American is kind of how they described it, but anywhere from between 10 and 13%, which is a little less than our representation in the population in the United States, but still is a decent representation as a representative representation in the country relatively. So it has been tested in minority groups, specifically Black people, but it's also been in our Latinx communities, Asian communities as well, but a little less than in the Black community though.
I heard the vaccine will alter my DNA.
That myth I have heard often as well. I would have assumed that would have been a top one or two. It's interesting because there are two types of vaccines that are currently in use. There are the kind of mRNA vaccines, so that's the Pfizer and the Moderna, and then there's the Johnson & Johnson vaccination. In the Johnson & Johnson vaccination, we have similar vaccines to it that we used before, so that's not the one that gets this kind of myth told about it necessarily, but it's the Moderna and the Pfizer that people kind of have this concern because it has mRNA in it. So even though that mRNA sounds similar or looks similar to DNA, they are two completely different things. Those vaccines do is really just send a message to the cell, to a part of the cell that is completely separate from where DNA lives in the cell. They send a message to this area that basically tells it, hey, this is what you need to make sure that if this virus or this thing shows up, that you are prepared to protect us. And by us, I mean like the other cells in the body. So I need y'all to start making this thing so we can get the body prepared just in case this thing shows up and we got to jump into action. And that never goes into the kind of brain of the cell, so the nucleus where the DNA lives. And we know that because we know what mRNA does, and we've known that for, decades more than we've known about, this kind of technology.
How about the myth that getting the vaccine actually gives you COVID-19?
Yeah, I've also heard that one. It does not, as a short answer, because I hear that same myth about influenza vaccinations. But I think the thing that people often kind of get mixed between is the side effects of the vaccine sometimes. So as we talked about a little earlier, most people don't think the sore arm is an issue or as much of an issue, but if you start feeling tired or fatigued, or if your joints get stiff and achy, or if you get a headache, or you get fevers and chills, you may liken that to a kind of COVID infection, but it most definitely is not. One, because there is no actual virus in these vaccines, so there is no way for the vaccine to give you COVID because there's no COVID in it. Sometimes just because the word COVID is in the vaccine's name, it kind of gets confused in that way. But it definitely does not give you COVID-19. And, I think if this is the reason that you're not being vaccinated, I would just look and see to try to get some perspective on what the experience of a person is who actually has COVID-19 and has had to experience what it means to be infected with it and to have a severe infection, and kind of what that looks like in reality. Many of us likely have people in our families who have been infected if we have not been infected ourselves. So I would just encourage folk to kind of look around and see what other people have experienced.
Dr. Gilliam, I've heard that the COVID vaccine was developed to control the population through microchip tagging. Like that there's a microchip that gets inserted in your arm with the vaccine.
Well, I can tell you that's not true. It was developed to really kind of help us out of a global pandemic that's really decimated all of our communities. And I've not only received the vaccination, but I've actually witnessed thousands of people receive vaccinations. I've witnessed, my nursing staff who vaccinated those 16,000 plus people at NorthPoint, draw up the vials, prepare them, and I've seen them use the syringes and the needles, and there are no microchips present anywhere. I can attest to that. If there was anything I could be trusted on, I could tell you that one. So this is not an issue. I know that it is a concern of some people, but I can tell you from having received it and having witnessed thousands of immunizations at this point, that there is no microchipping occurring, and quite honestly, the infrastructure does not exist to, I don't even know what they would do with the microchip, but this is not present in the vaccine and any of the products that are used to vaccinate people.
Will the vaccine alter my ability to have children?
It will not. There's a lot of question around that in terms of, it kind of lends to, I think that was Z had the question about his sister who was pregnant. And so we know that it does not kind of cause any issue with those who are pregnant. But we also know that it does not cause any issue with fertility. Because not only have people gotten pregnant after being vaccinated, we do also know that anything you can do if you are trying to become pregnant, anything you can do to keep yourself as healthy as possible during your pregnancy is recommended. So being vaccinated prior to becoming pregnant would be the recommended thing from any provider or person that you would talk to if you were going in for, counseling prior to becoming pregnant. They tell you to exercise, eat healthy, take a multivitamin, take a vitamin D, and get vaccinated because you want to be as healthy as possible so that your baby is healthy. And then you also want to protect yourself from this virus that has caused this global pandemic.
Okay, a few more myths here. What about those that say, I'm young, I'm healthy, I don't need to get the vaccine?
Well, youth is not a protection against infection. Good health does not guarantee that your experience with COVID-19 will not lead to severe illness with hospitalization and potential death. We have many examples of young people who have gotten severely ill, many examples of young people who have been hospitalized and have died. Also many examples of young people who have not, but you never know which category you fall in. So you do need to get vaccinated no matter how young or how healthy you consider yourself to be.
How about the myth that if I've already had COVID-19, I don't need to get the vaccine?
I hear that myth as well. I know the current guidance is that once you've been infected with COVID-19, you're considered to have some immunity for about 3 months after being infected. And so we do recommend after that you get vaccinated so you can have a prolonged immunity. But you don't necessarily have to wait 3 months. So if you have an infection and you didn't have any symptoms, you wait until you're done with your quarantine, and then you get your vaccination. If you did have symptoms, you just wait until they're done, and you're off quarantine, and then you can get your vaccination. So we know that the natural immunity from having COVID-19 does not last as long. So we do recommend everyone get vaccinated against COVID-19, no matter if you've had the infection or not.
And our last myth, everybody else is getting vaccinated, so I don't need to get the vaccine myself.
Not true. That's why it's a myth. And I think this kind of looks back at a previous question about our kids, because not only is it that those who are younger, so less than 12, they cannot be vaccinated. What we're seeing is that some of us whose immune systems are not as able to produce the level of immunity we need, they may not be as protected as some of us. And they're not just the kids can't be vaccinated. There are some in the community who just can't be vaccinated for a number of reasons. So if you decide not to be vaccinated and then I decide not to be vaccinated, we now then have more people who are able to pass and spread the virus, as we talked about before. So the more of us who get vaccinated, we help in protecting those who cannot. So we protect our kids, we protect our elderly who may not have been vaccinated because they couldn't, or if they were and their immune systems didn't kind of give them as good a response as it could have, we protect them from potentially being impacted by the virus as well.
Thank you for discussing all those myths. We did have another question come in that I want to tackle quickly here. It says, Dr. Gilliam, my cousin is in serious need of long-term rehab for various health issues not related to COVID, and he refuses to get vaccinated. The question is, can he be forced some way to get vaccinated since he's still living in a rehab facility with other patients?
Good question. I think, and thank you for that. At the moment, no. It is, we, as decision-making adults, we are able to kind of make decisions on our own, whether we as a community agree with those decisions or not. We are able to kind of make those types of decisions, and so we wouldn't force medication or immunization on anyone against their will. Even though I would agree that it is his best interest, it's not something we would do against their desires.
So where can I get vaccinated, or where can everybody get vaccinated?
Call NorthPoint. So you can call our vaccine line at 612-348-9000. I think it's on the screen. Or you can visit our website, northpointhealth.org. And so that's for anyone who's 12 and up. And it's completely free. So the only thing we need from you is your time. So call us at that number, go to their website, come to our site, 1256 Penn Avenue North. And as a bonus right now, if you were to get vaccinated, we are giving out $50 Visa gift cards to all those who receive vaccination. This is only while supplies last. So if we run out or when we run out, they will no longer be available. But again, call that number, go to their website, come and see us at the corner of Penn and Plymouth. So you can get vaccinated, bring a friend, the more the merrier. And see you there.
Well, I want to thank everyone for tuning in. Thank you, Dr. Gilliam. Definitely want to remind everyone, like Dr. Gilliam said, to go out and get vaccinated. If you want more information, visit northpointhealth.org. Call us, like Dr. Gilliam said, that number again, 612-348-9000. And we hope everyone has a great night. Thank you so much for tuning in.
Thank you.